Drop your head now. Like this. Just let it. Did you feel that one?
Mm-hmm.
All right, so we have Coleman. He is an instructor for indoor cycling. Tell us about what you want to look at today.
Primary focus is like going to be in my left knee. Just through like tension of teaching, I experience like a little bit of like light pain when walking, like in the left-hand side. I feel like it's because of like a tight IT band.
Okay.
Yeah. And then lower back pain as well.
Okay, and it's all on the left.
Yeah, mostly on the left.
Okay, and how's your neck today?
Slightly tense.
Okay.
Yeah, but I think that's just from like the everyday like New Yorker lifestyle.
All right, cool.
Just natural tension.
So jump on the table, face down. We're gonna start. I'm gonna do a little more analytical stuff on your knee because the knee is tricky and there's a lot of moving parts. If there's something like a torn meniscus or cartilage damage or torn ligaments, I'm not gonna be able to do that much for it.
Right.
But if it's misalignment and linkage to it or the IT band work, I can help a lot, but that also just takes time and you have to work above and below it as well. So rather than just totally just trying to only do foam roller on the IT band, I like to try to catch the back edge where you're getting some of the hamstring or the front edge where you're getting the vastus lateralis. But I also like looking below the knee. And I also like looking in the glute medius. I also like the tensor fasciae lata. So you could roll out the tensor fasciae lata with the edge of a foam roller. You can do some glute stuff. A lot of times you got to do some glute strengthening stuff where you're creating the clamshell type moves. You're going to band your thighs and do that stepping thing. Have you ever seen that? Here, look this way. You band your thighs and you step.
Oh, no, I've never
and
seen
that works the glutes. But you can look up glute medius exercises specifically. But that helps the IT band. But let's just dig in and look at knee alignment first because that's what we're set to do today. Bring your arms back alongside your body. And I'm going to first just see what your leg alignment looks like. And your right leg's pulling really short. So I'll bring it up to position 2. So just let me have the legs. I'm going to bend them up. And now they're even. So the first thing I'm going to do is just check into the knee. And actually when I stroke down on the medial collateral ligament of the left knee, the legs balance. So I'm going to do an adjustment on that. There's a setting for the knee. You're going to feel me tap it. But first tell me if you don't feel that this spot is a little tender. Here, let me find it. Do you feel that little insertion point? Is it tender at all or not really?
Probably like a 6 out of 10.
Okay, 6 out of 10. So I'm adjusting. I got right on that crease of the insertion point. And then I'm also adjusting, take out a little inversion in the ankle. And legs aren't perfect, but they're pretty close to perfect. And I'm bringing them back up. It's even. I bring them past 90 degrees. Look again. And that made the legs go short again. So you have a little bit of sacrum stuff. Keeping this leg long, lift this leg as high as you can. Good, and then do the other leg. And do they feel even to you?
Definitely not.
Which one is harder?
Definitely this.
Okay, so let's put that down. I'm going to dig into this spot with my thumbs. I'm going to look for a nasty trigger point. I'm going to have you do kind of like a dancer's passe on the left. And that will give me an angle to really dig out this spot here. And I think it's right in here. Tell me if that's an ow.
Yeah, definitely.
That kills, right?
Yeah.
So take a big breath in and blow it out. Now straighten that leg and put it next to the other leg. Keep it on the table. So turn that thigh down. Good. And bring it back up again. Slide it up. Bend the knee. There you go. Keep going. One more. And then straighten it as you turn your thigh down. Good.
Ooh.
Now I'm going to adjust it with this instrument. I'm going to push it down in a few spots. I'm going to come in here to the SI joint, dig in. And I'm looking for angles. I'm looking to really dig this in and find the edge of the sacrum. And boom. And then I'm going to hit this down like this. Now lift this leg up. How did it feel that time?
A lot easier.
A lot easier.
Yeah.
Now I'm going to do some, put it down again. Here, look, just so you know before I kill you. So I'm going to do a little bit of this in there. So drop your head. I'm going to pound the sacrum down a little bit. Now lift that leg. How does it feel now?
Pretty good.
Yeah.
Okay, so there's more work to do, okay? We still got to go back to that knee. Good, drop your head. Good, so now I'm going to push the knee forward. So I'm going to grab behind the tibia at the top and push it forward. And that made the leg go really short. So that means he has an anterior tibia. And I'm going to come as close as I can where I'm still not, I don't want to hit the patellar reflex or his leg will probably kick me right in the jaw. And I'm going to adjust into pretty close to the tibial plateau, but not maybe half an inch below it. And I did not hit the reflex that would have him kick me. So let's push this forward. And it's holding. That's good. So the next thing I'm going to check is external rotation. I grab the calf and the tibia together and I externally rotate it. And look, it made the leg go short. So he has a little bit of external rotation misalignment. So I'm going to internally rotate it. Then I'm going to fire into the side here. Let it come internally rotate. Boom. And I hit the side of the tibia close to the top. And let's see if that holds up. So now I'm going to externally rotate it again. It's holding its adjustment. I'm going to grab the fibula next. I'm going to drag it up superior because fibulas like to move that direction. Then I'm going to grab a posterior. And that actually is misaligned. So it has a posterior fibula misalignment. I get on the fibula head and I come down. I still like to take a little inferior angle, but mostly it's from P to A, posterior to anterior. Good, I got that. Let's recheck it. Good, so let's check the valgus varus strain, which is kind of like knock-kneed or bow-legged. So I'm shearing it that way, and that threw it really off. So I come across the other way, and that helped. So I'm going to put it up to a little bit of higher setting. What's interesting is I'm coming right through the IT band insertion on this one. So do you feel how achy that is on you?
Mm-hmm. Major.
Major achy, right? And then let's see if it held. Good. I'm also going to check on compression. Sometimes that joint just gets compressed. Let's check kneecap. When I push it lateral, from medial lateral, it's misaligned too. So now I'm going to put a lighter setting because the kneecap is tiny and it floats. And I'm mostly just trying to give it a nudge in the right direction. That's really good. Now look, he's got these trigger points too. So he's got a lot of stuff. What do you think of that spot?
Ooh.
That's bad, right?
Yeah, definitely.
So you're going to move your your foot a little bit. Good. Keep going.
Ooh. Yeah, that's extremely tight.
That's really bad, right?
Very.
I'm going to pop in there a little bit too. Don't worry, I'm not going to hit you with a hammer. Okay. And here's another one. You feel that one?
Definitely.
These are all just nasty. Okay. And then you're going to get one back here too, usually. And it's lateral part of where the hamstring's tying into the back of the knee, and I just have to find it. And I think it's that one. Do you feel it?
Yeah, definitely. Oh.
How much is that on a scale of 1 to 10?
Like 8 to 10.
Yeah, it's nasty. All right, so I'm going to dig that out a little bit. There you go. Now I'm going to give this leg a pull. So I'm just going to tap it like this.
Mm-hmm.
Do you feel the whole hip pull out?
Yeah, felt it.
Yeah. Turn your face left and right. Let me know what the neck feels like. Is it tight to turn left, tight to turn right?
More the side.
Okay. Drop down. I'm going to clear that out for you, okay? So face down. So I'm going to adjust in two ways today in the neck. I'm going to adjust with the activator. I'm going to look for a couple of points that I can just see right away that are going on, like T1. I'm also going to come up to C2. C2 does a lot of rotation. It's one of the pivot bones that mechanically does a lot of rotation. And now I'm just onto a muscle here. I'm doing the trap trigger point up here, the real upper one. Turn left and see if it's starting to change. We might have to do this a few times. Mm-hmm. Does it feel any different?
It feels kind of the same.
Point to the worst spot. It's lower. Okay.
Yeah.
So let's do one more. And I'm probably just going to adjust it by hand next. So face down. So I'm going to find, oh, like that one you mean?
Yeah, definitely.
Yeah, that is nasty. All right. Yeah, so that one feels like a pebble. like a piece of stone. Turn your face to the left.
Okay.
What do you think?
Feeling looser? Yeah.
All right, so now let's do
right
some...
direction.
Here, let me take off those shoes. You don't get to keep them. They're not so flattering anyway. So curl up to the top of the table. I'm going to do a prone adjustment, and that way I can get really in on his trap at the same time. Drop your face down, and I'm going to come in right in here, and I'm going to come right, I'm really looking close to the T1 rib, and tilt your head this way. So let's just keep it loose. Drop your head now, like this. Just let it, did you feel that one? Big
Wow.
release in there. Turn your face left now.
Yeah, wow.
Big difference, right?
Yeah, I mean, like, very little tension. I'm trying to get it over there.
Okay, good. So come this way. We're going to do one on this side too, okay? No, so start face down. I'm going to come right into there. I'm going to drop down, pull the tissue, traction the head up a little bit. Did not go. Lie on your back. I don't want to keep doing that one. Especially because I can do it from this side. So now you're going to lie on your back. And I'm going to kind of do the same thing. I'm just changing angles. Do you feel that right in there, though? That's kind of where I'm going in. Good. So I'm going to flex first. Bring your head back. Soften up the SCM. Got it.
Nice.
Good. Scoot towards me. I'm just going to do a little mobilization in the upper thoracics. Wow.
Wow.
That was good. So now lie on your side facing me. I'm just going to clean up a little left in the lower back. So we did a lot. I worked on that knee. I found a few different misalignments.
Yeah.
A few angle changes. You do have to work on the IT band. I would strengthen the glute medius. Let this knee roll down towards me. This stays behind like this. Got it. All right, that's it.
Yeah. Wow.
So come sit
Really
up
cool stuff.
and swing this way. How do you feel now?
Loose, definitely. I was like teaching classes this morning and had like tons of tension walking in.
So that's
Really good.
awesome. So stand for a second, see what that knee feels like. You might have to really test it to determine it.
Yeah. I mean, I feel like I'll feel a lot more when I'm walking, but definitely like a lot more mobile.
But, or when you're spinning, you might notice it.
I do feel a lot of tension when I'm like sitting on it a lot. So I guess it's just because of like the natural angle, but I definitely feel so much difference. Yeah.
Cool, man.
Feels good. Thank
All right,
you.
thank you.
Yes.